AIDS Resources Emergency Act, medical facilities are required to notify emergency responders of potentially infectious diseases involving patients they transported no longer than blank hours from the time they have a suspect case. D48. 2. Which of the following examples provides the best description of indirect contact with a microorganism? B. Touching a bloody stretcher railing with an open wound on your hand. 3. Which of the following is not a factor in determining a person's risk of contracting an infectious disease following exposure? C. The age and sex of the patient. 5. When a disease infects large numbers of people and spreads all over the world, it is considered a D. Pandemic. 4. Unlike bacteria, viruses B. Die when exposed to the environment. 6. Virulence is defined as the C. Ability of an organism to invade and create disease in a host. 7. An individual's ability to fight off infection is called C. Host resistance. 8. A person is exposed to the mumps virus, is asymptomatic for 16 days, and then becomes ill. The 16-day period is called the incubation period. 9. In the context of a communicable disease, a blank is a place where organisms may live and multiply. B. Reservoir. 10. A healthcare worker's fear of contracting a communicable disease is most often the result of D. A lack of proper education and training. 11. After an employee who believes he or she has been exposed to an infectious disease notifies the designated infection control officer, the DCO should B. Determine whether an actual exposure occurred. 12. In contrast to body substance isolation precautions, standard precautions C. Emphasize protection from moist body substances that may transmit bacterial or viral infections. 13. Which of the following is not included in the Centers for Disease Control and Prevention's list of recommended immunizations and tests for healthcare providers? Annual HIV testing. 14. Personal protective equipment. Serves as a secondary protective barrier beyond which your body provides. 15. Which of the following medical procedures would pose the least risk of exposure to an infectious disease? D. Assessing a patient's temperature by the oral route. 16. When washing your hands after a call, you should B. Use an antimicrobial, alcohol-based foam or gel. 17. Most infectious disease exposures in healthcare providers occur due to C. Sharps injuries. 18. Post-exposure prophylaxis is available for all of the following diseases, except B. Hepatitis C. 19. Following a significant exposure, the source patient is routinely tested for all of the following, except DHPV antibody. 20. According to the Rhine-wide Comprehensive AIDS Resources Emergency Act, the medical facility must release the source patient's status to the designated infection control officer. 21. Work restriction guidelines enforced by OSHA require an employee to use sick time for an illness, unless C. the illness is the result of an occupational exposure. 22. When obtaining the sample history of a person suspected of having an infectious disease, you should specifically inquire about B. a history of recent travel. 23. A common sign of the measles is B. a blotchy red rash. 24. The onset of fever commonly occurs as early as blank days following exposure to the measles. D7. 25. Rubella is characterized by a low-grade fever. 26. According to the Centers for Disease Control and Prevention, all children should be immunized against all of the following diseases, except as smallpox. 27. When disinfecting the ambulance after transporting a patient with rubella, you should use standard disinfection procedures. 28. Which of the following statements regarding the mumps is correct? C. Mumps presents with fever and swelling of the parotid glands. 29. Transmission of mumps occurs by direct contact with the blank of an infected person. B. Saliva. 30. In older adults, shingles arises when the blank virus resides in the ganglion of a nerve. B. Varicella. 31. Which of the following diseases is bacterial in nature, has an insidious onset, and is characterized by an irritating cough that may become paroxysmal in about 1 to 2 weeks? D. Pertussis. 32. Which of the following statements regarding meningitis is correct? Most epidemic outbreaks involve meningococcal meningitis. 33. Common signs and symptoms of meningitis include C. Mental status changes, fever, stiff neck, and headache. 34. Antibiotic therapy following exposure to meningitis is not appropriate for individuals who are taking birth control pills. 35. A person with TB infection D. has tested positive for exposure to TB. 36. Common signs and symptoms of TB include all of the following, except B. Photophobia. 37. A paramedic would most likely be infected with TB if he or she B. performed mouth-to-mouth on a patient with active untreated TB. 38. A person who is taking antibiotic therapy following a positive TB skin test and chest radiograph should not consume alcohol because C. the antibiotics are toxic to the liver. 39. The leading cause of lower respiratory tract infections in infants, older people, and immunocompromised individuals is the D. Respiratory syncytial virus. 40. Mononucleosis is caused by the blank and grows in the blank. A. Epstein-Barr virus, epithelium of the oropharynx. 41. The clinical presentation of mononucleosis includes a fever, swollen lymph glands, and an enlarged spleen. 42. If you do not receive a flu vaccine and are exposed to a person with the flu. B. Antiviral drugs may be given within 48 hours after the exposure to reduce the severity of the flu if you contract it. 43. Transmission of a gonorrhea occurs when contact is made with B. Pus containing fluid from the mucous membranes of the infected person. 44. Gonorrhea in females. C. Often goes unnoticed until signs of acute abdomen appear. 45. The primary infection with syphilis produces C. An ulcerative chancre at the site of infection. 46. Secondary syphilitic infection is characterized by all of the following, except a petechial. 47. Which of the following statements regarding genital herpes is most correct? D. Cyclovir is used to reduce a herpetic outbreak, but there is no cure. 48. In males, infection with chlamydia trachomatis would most likely lead to B. Prostatitis. 49. Chlamydia trachomatis is caused by a blank and is treated with an blank. A bacterium, antibiotic. 50. Nocturnal itching and the presence of a rash involving the hands are indicative of C. Scabies. 51. If a paramedic is exposed to lice, B. Permethrin cream treatment may be prescribed and restrictions from patient care may be indicated until the paramedic is free of lice. 52. Hepatitis B is also referred to as D. Serum hepatitis. 53. Following exposure to the hepatitis B virus, a person may remain asymptomatic for up to 200 days. 54. Early signs and symptoms of hepatitis B infection include all of the following, except C. Jaundice. 55. The third dose of the 3-series hepatitis B vaccine is given 6 months after the first dose. 56. If you are exposed to the hepatitis B virus and have a positive titer on file, B. No follow-up treatment is required. 57. Occupationally acquired hepatitis C virus infection. D. is related to a contaminated needle stick with visible blood on the sharp. 58. Most patients infected with the hepatitis C virus are unaware that they acquired the infection because B. They do not develop phase 2 signs and symptoms. 59. Which of the following statements regarding the hepatitis D virus is most correct? C. Infection with HDV requires the host to be infected with the hepatitis B virus. 60. The primary target of infection with the human immunodeficiency virus is a immune system. 61. The communicable period for HIV. A is largely unknown. 62. Signs and symptoms of HIV infection may include all of the following, except D. Right upper quadrant pain. 63. Acquired immunodeficiency syndrome. D is characterized by the presence of opportunistic infections. 64. If the source patient's blood tests positive for HIV, B. The blood will be assessed for viral load, and the exposed individual may be offered a 4-week trial of antiretroviral therapy. 65. Hepatitis A is often described as a benign disease because C. Lifelong immunity occurs once the disease is acquired. 66. In addition to children, the hepatitis A vaccine is recommended for B. Emergency response team members traveling outside the United States. 67. In developing countries, there is a strong association between the hepatitis E virus and inadequate hygiene. 68. Which of the following statements regarding West Nile virus is correct? D. There is no period of communicability because WNV is not transmitted from person to person. 69. The avian flu. A is caused by a virus that occurs naturally in the bird population. 70. The most effective ways to protect your patients from nosocomial infections include C. Not reporting to work when you are sick and keeping the interior of the ambulance clean and disinfected. 71. You receive a call for a 33-year-old man with difficulty breathing. Upon arrival, you begin to assess the patient, who tells you that he is HIV positive. During the primary assessment, you should B. Identify and correct immediately life-threatening conditions. 72. A 49-year-old woman presents with a severe headache, a temperature of 103.2 degrees Fahrenheit, and photosensitivity. Her blood pressure is 140/76 mm Hg, pulse rate is 120 beats per minute and strong, and respiratory rate is 22 breaths per minute, and regular. While caring for this patient, it is most important to B. Protect yourself from any nasopharyngeal secretions. 73. While assessing a 59-year-old man with an acute onset of crushing chest pain and diaphoresis, the patient tells you that he recently tested positive to a tuberculin skin test. His vital signs reveal hypertension and tachycardia. You should be most concerned with D. The fact that he may be experiencing an acute myocardial infarction. 'C. Gonorrhea. 75. A 70-year-old homeless man presents with a rash to his hands, wrists, and ankles. He denies any known allergies and states that the rash itches severely at night. His vital signs are stable, and he is breathing without difficulty. You should transport him to the hospital and thoroughly wash your hands after patient care has been completed. A jaundiced skin. Avoid removing his wallet or any other possessions from his pockets. 78. You and your partner are transferring a 76-year-old woman from a local nursing facility to the emergency department for evaluation of an acute onset of fever. While reviewing the transfer record, you note that the patient was recently treated with daptomycin. This patient most likely has dimethicillin-resistant Staphylococcus aureus. You may be quarantined for up to 10 days, and will be asked to check your temperature daily.